Hi everyone, my name is Chris Chukwunyere and I'm a public health expert. You're welcome to my COVID-19 series, and today I'm going to be talking about the importance of the right communication in an infectious disease outbreak period like this. All right, so recently there is the talk about the progress medical practitioners or researchers have had in terms of using chloroquine or hydroxychloroquine to treat someone who has been infected by COVID 19. And that news is out there, and people are going out there to buy chloroquine and taking it without a doctor's prescription as a means of preventing the virus. Come on, guys. This is really very important because during the time of Ebola, a lot of people drank salt water, a lot of quantity of salt in the water. To some of them used it to have their bath just to prevent the Ebola virus infection. That actually caused a lot of health situations in the country. And you know how these things spread from one WhatsApp group to the other, one broadcast to another. It gets even to the remotest of the communities. And once it spreads that way, especially for people in the remote community or in the rural communities who don't have access to radios, to TVs, who are not educated, they just get an information, and because they're cut out from the rest of the world, they just go on to carry out that information without any guidance, without anybody telling them what to do, just because they heard it. And that's why the wrong information can actually destroy faster than the virus itself. So please, in fact, yesterday I read from a US tabloid that two Nigerians have been poisoned from taking chloroquine. See, if your doctor does not prescribe chloroquine, I know that in Nigeria you can go to the pharmacy even without a prescription and you get the chloroquine. Please stop it. Let's try as much as we can to get the right information. As far as Nigeria is concerned, the right information comes from the Federal Ministry of Health. The right information comes from Nigeria Centers for Disease Control. The right information internationally comes from CDC, WHO. So please, let's try as much as we can to get the right information. And for those of us who spread information or who are disseminators of information, let your content, let your information be right. Let it be the right thing, okay? So people should not go about drinking chloroquine without a doctor's prescription. Don't go drinking whatever, salt in water or anything because you think it's going to protect you from the coronavirus infection. Pass this information around. Let's make sure that people do the right thing. Now, the FDA in the United States has approved the use of the hydroxychloroquine or chloroquine as a means of treatment. But then it has to be with supervision. It has to be with the doctor's prescription. It has to be the doctor who would know how to use it to treat you, because these medications have side effects. They have side effects, and that's why it's important for a doctor to know how to treat you. You could have some medical conditions that will not allow you or does not allow you to take chloroquine. Let's try as much as we can to follow the right instructions, do the right things, and don't self-medicate. Nigerians, please, all across the world, please don't self-medicate. Please and please don't self-medicate. If a medication is not prescribed to you by a doctor, please do not use it. I learned that chloroquine in the pharmacy stores have gone scarce because a lot of people have gone to buy it, probably to keep it, and some are drinking it at the moment. Please, let's share this information. Do not take chloroquine without a doctor's prescription. If you have a lot more information about these things, or you are more knowledgeable about these things, call your parents, call your family members, talk to them about this, let them understand the importance of getting the right information. make it your responsibility to get the right information and spread across your circle of influence. This is one way to contribute and being part of the solution of the problems of this world at this time. Call your parents, call your older siblings, call your aged grandparents, and let them know that they don't do anything without letting you know if you're the one that has enough information. If you don't have enough information, get the right information. Ask the person who is more literate amongst your family members and share the right information with them. Okay? All right. Share this video. It may help someone. Bye.